everybody. I'm Lauren.
I'm Emma.
And you're listening to The Oakview. Hello.
Hello.
Hi, everybody.
Hello, friends. Thank you so much for coming.
We have a very special guest on our show today.
We have two very special guests, Lauren.
Please explain.
We have our good friend, I'm saying our, Kelli.
Thank you.
Dr. Kelli Bowman, veterinary medicine, and her dog, Dooley. Dooley is a Bernese mountain dog, and he is the cutest little thing in the whole wide world. I love him so much.
Kind of like the opposite of a little thing, though.
Oh, that's true. This dog is literally the size of me standing up, and he is a beast. He is large, but he is the cutest little face, and honestly, best dog, 10 out of 10, hands down. So welcome, Kelli. Welcome to the Oakview. This is
Hi, thank you.
a wonderful time to...
Yeah,
Kelly's one of our nice friends who listens.
I do.
Kelli listens quite often.
This is so strange. So we get a lot of boxes at the vet clinic, and someone has to go in the back and like break them down and like take all the tape and stuff off. So I often do that, and I listen to you guys while I break down boxes.
I love a good working box
Dead
girl.
serious.
That's what we need. We need someone that's dedicated to listen to us while they're at work.
Yeah.
Wow.
Yep.
Amazing. Kelli and I have been friends since, oh my gosh, forever. Not as long as Lauren and I. Yep, 8th grade.
Yep.
But we all went to the same high school, so that's how Lauren knows Cal.
Yeah,
but,
kind of through Emma.
Yeah.
Yep.
Mm-hmm. But Lauren has some beef with me.
Yeah, Emma always pretends like Kelly and I are not
Besties.
friends. And I feel like Kelly and I are super tight. Are we not, Kel?
Definitely. Oh, absolutely.
No.
We are
stop.
tight.
No,
Kelly and I are friends.
I'm just saying, all I'm saying is, like, didn't think you weren't friends. It's just, it's very different.
No, that's true. But, like, literally, Lauren, we were pen pals in our freshman year of college. So Lauren made this post, I think on Facebook, about like, hey, who wants to like write letters? Give me your address. And I commented on it. And I think for a full year, we sent letters back and forth.
And they were like
actually detailed.
Yeah,
like,
they were like
how is
actually
your
like
life?
long letters,
Yeah.
like
Wow.
like a
and we
full
told
page.
each other about our
When
lives
did you
and
ever
what was
write me a
happening.
letter? She's like, we went to the same school.
I'm not saying that I'm a better
I
friend,
had
but
lunch with you every day. You know, Lauren wrote me a letter once.
Did you
She actually
answer it?
sent me a care package once.
Oh my god!
I'm sure I did.
This
And
is
you
the
know-
kind of friend Lauren is. 10 snaps.
I also sent you the birthday present that I am most proud of in my life
That's
to
the
you
care
at college.
package I'm thinking about, Lauren.
Like that is the gift that I bring up when I tell people I'm a good gift giver.
So it was my golden birthday, my freshman year of college. She sent me all these like gold things, sparkles, glitters.
Oh, I bought her a milkshake.
Yeah, that's true. But Lauren did send me a package once, and it was not so fun because I thought something was wrong. Lauren sent me an STD care guide to how to combat, STIs, STDs, and like
I sent it as a joke.
That's
hilarious.
Not only was it like a pamphlet, it was like
Hey,
a book.
As your
Like
best friend,
cards
I just
and
wanted you to be
pictures.
educated and make good choices,
Yes.
okay?
Snaps for that.
I am just spreading good knowledge here,
Yes.
all right?
You didn't even give me any context. You were just like, here. There wasn't even a
I
letter inside.
just
it was
don't
like, here's
think
Oh my
that
god, there was
you-
no explanation.
No.
She
I
was
just don't
like,
think
have
that
this
you
STD
appreciated
book.
it
Yeah.
enough.
Yeah.
all I'm
That's
saying.
excellent. I really liked. I never knew that.
Emma, I want you to know, although Kelly and I are like BFFs,
Yeah, true.
Okay.
it's true. She just confirmed.
Yeah.
Although Kelly and I are BFFs, sometimes in my letter I would be like, look out for Emma for
Yeah.
me, or I'd be like,
Everyone should have
You
been
know-
looking out for me. So
Yeah.
it's good.
So yeah, the background for people, Emma and I went to college together. We both went to the University of Minnesota, and Lauren went to Bradley University in Illinois. So I was with Emma like physically more often.
We were like together. But Kelly's best friend Casey went to Bradley with Lauren, so it's like we kind of
Yeah.
did like a flippy floppy.
Yeah, we kind of did this like, hey, you take care of my person and I'll take care of yours. Not that we weren't all like we all knew each other, but
Right.
Yeah.
I really appreciate this. This is a great time. Even
Yeah.
Dooley has an opinion over this. Cal, I appreciate you as a person, but I guess I don't have like a friendship as the two of you. So
yeah, we say as we're literally sitting in my kitchen
that's
together.
true. I did come up to see Cal and the doggy, and that's been great.
Yeah, it's been really lovely
to
have you here.
On a serious note, Cal, I'm really interested in what you do as a veterinarian, a doctor, a veterinarian, and how you got here. And, like, basically, tell us what your degree is. Why did you want to be a vet?
Mm-hmm. So I decided that I wanted to be a veterinarian when I was about 4 years old. Fully believe that is because I asked my mom what I could do with my life to work with puppies every day. And she was like, you should be a veterinarian. Which, retrospect, Mom, we could have gone with, like, open an animal shelter or, something that did not require 8 years of schooling, but that's fine. Whatever. So, yeah, I like, decided that, oh, cool, well, that's what I'm doing. Somewhere around 12 years old, someone told me that meant vet school. Up till then, I had no understanding of, like, I thought you just, like, did high school, then, like, disappeared for, like, 4 years and came back and you, like, were whatever you were.
Right. We're all uninformed.
Right. Yeah. So eventually learned that I had to do a lot of school, dealt with that.
Mm-hmm.
I am very lucky to be, like, pretty good at school, I guess.
Kelly is so modest. No, Kelly's very smart. She really is. No, she really is smart. She's a doctor.
She's a doctor. I'm the engineer over here, and I am the least. Like,
you are not going to
disrespect
my friend
call.
like that.
Right. Like, first of all, don't. But second, how
I'm talking about you.
Are you talking about me?
Just as, like, degrees, though. But that is not how we measure intelligence.
If we want to do that, I'm number 2. Kelly's number 1. Lauren number 3.
Of course.
We're not.
So excited. I'm a smart one.
I'm smart too. There are days where I do forget that I have a master's degree.
Yeah, you, like, literally do. True.
Not that it's a competition, but Kelly gets to, like, pet cats all day.
So, I was pretty dead set on it. Applied to college knowing that I was going to be pre-vet with a minor in Spanish studies because I've been speaking Spanish since I was about 4.
That's cool.
Went to the U of M with Emma. Loved it. Loved everything about the University of Minnesota. So much so that I stayed there for vet school. So I lived in the Twin Cities for 7 years because I was lucky enough to get through my undergraduate degree in 3 years. And then vet school is a full 4 years.
Yeah.
It is grueling and equally the best and hardest 4 years of my life, for sure.
Yeah, I can't imagine. But, it's really cool that you... I mean, I would assume that, like, being in Minnesota the long time that you were was the best choice,
Yeah, I think when I was trying to pick, I was lucky enough to get into several veterinary schools and had to choose between them.
Yeah.
And it kind of came down to that, like, this is already my home. So, like, simple stuff. I already know how to get to the store. I have a doctor. I have friends here. I don't have to uproot my life. Made it a very comfortable, easy transition for me, which was nice. But I graduated last May, and now I am a mixed animal veterinarian in Slayton, Minnesota, which is kind of the southwest corner of Minnesota. So I work with I don't know. I guess it's like 50-50. It's probably more like 60% small animals, so cats and dogs, to 40% large animal, but it really varies by the day. See.
Sorry not to interrupt you, but does small animal also include just small animals, or is small animal a specific category that you put dogs, cats in, and like fish and stuff?
So it is a specific category. Like, it's not about does it weigh 50 pounds or less.
Because that's what I understand.
Yeah, no, it is companion animals versus production animals or farm animals.
Oh,
yeah.
Okay.
And then
I need to know.
Yeah, so it depends on what you'd be talking about with fish. So, like, your goldfish that lives in, like, a small tank, like, in your house, and you just have one goldfish, that would be a companion animal thing. But I've never seen anyone bring a goldfish into the clinic.
Because most people go, my fish died.
Yeah, and you just, like, get a new one and no one knows. However, there is, like, large-scale fish production that exists, and that would be kind of more on the food animal side of things.
I have so many questions, but I'm going to hold off. Okay, so your degree is a doctorate in veterinarian medicine.
Correct.
Okay, I just want to make sure I say that correctly.
Yeah, a DVM.
That's very cool. Now,
thanks.
Cal, we always talk about me and Lauren being females in the STEM world, and how that's very it's very male dominated. So I'm curious, Lauren, I'm wondering if you have the same question, is like, what does that look like to be a female
Yeah.
doctor?
What is the veterinarian perspective from that? Because I feel like veterinarians are kind of woman dominated, if I'm not wrong.
Yeah, so that's actually kind of a newer thing. My class in veterinary school was 80% women. So definitely female dominated, but that has changed considerably. There's actually a hallway at the U of M where you walk through and see every graduating class from the U's vet school, which is really cool, just like to think of the history. But you can watch it go from a class of, 15 men in a black and white photo. And as you walk down the hallway, you get about a third halfway down, and there's the first woman, and there's just one.
That's
and
cool.
then you kind of keep going, and then maybe there's a sprinkling, and then you get to see the really excellent, hairdos from the 70s. And then you keep going, and you can watch it become very female dominated.
Mm-hmm.
But what's interesting about what I do is the large animal side of veterinary medicine up until recently was still very male dominated, even though the industry overall was kind of transitioning to being female dominated. So there are definitely times where I, as a female, am perceived differently in the large animal group of what I do. I also have to do things differently. Like, right, I'm 5'6" and blonde. It looks different when I jump out of my pickup truck than when a big 6'4", 300-pound man does. I have to, do things a little bit differently. My wingspan is shorter, but I still can do the job.
I was gonna say, I don't think your skills would make a difference. No, matter how your size
but
is.
there are a lot of people that are like, oh, well, how would you do that? I'm like, I climb on a fence, or I'm perfectly capable of doing my job. Thank you very much.
You find the way.
Yeah. It's ingenuity, right? The same as anything else in life. But yeah, it's definitely a recent change that there are more women even in the large animal side now too. Which I know, Emma, you and I have had a conversation about this when I listened to your guys' episode on, I don't remember specifically what episode it was, sorry. But when I listened to the episode, when I listened to the episode where you kind of discussed, male-dominated fields and how it changes, we had a conversation about how veterinary medicine is changing, and I posed the question, like, but is it as good as it seems, or is that a like, oh yeah, women could like be veterinarians and like play with puppies and whatever, or is it women are caretakers, so they could be a doctor, be a veterinarian? And I don't really know what the answer to that is, but it just makes me wonder, makes me think, because certainly I know.
It's very interesting that there's a rise of female veterinarians, and that field is changing, but other doctors, human doctors, is still male dominated. So why is that? Like, where's the difference there?
I don't know. And like, it does mildly irk me, because like the cynical back of my brain is like, it's because people think it's easy.
But in reality, I feel like it's hard.
Yeah, so it's 3 times as hard to get into vet school as it is to get into medical school, actually.
Wow.
But why?
So I guess I don't really know the answer to that, but one, there are less veterinary schools in the world, and it just attracts a very specific, competitive, perfectionist, type A kind of person. So an interesting thing about vet school is you take the person, the top of the class, right? You take the person who's used to being the smartest person in the room, used to being number one in everything they do, and you put 100 of them in a room together, and suddenly you're average. And there's 3 ways that you can deal with that. One, you can have never cared at all. That would be my large animal friends that always sat in the back of the room. For whatever reason, that's what we do. I don't know. You can accept it, acknowledge it, accept it, move on. Okay, I'm normal now. All these people are smart. I'm still smart. Or it can really bother you. And those people never get over it. And they, we'll say, just struggle because of that.
I know some of those people.
Me too, girl.
But I wonder if that has everything to do with just the nature of the beast. So like you're fighting to get in and to be good and to be the best. And not only that, but like you're going to be a doctor. It's not like we're competing for Cocoa Puffs here. We're
Yeah.
trying to become a doctor.
Yeah. I definitely went through a period where like the goal for a long time was to get into vet school, right? That is what I had to do, was to get into vet school. And then you get in and you're like, what are my goals? What do I want to do? And you're like, oh, to be a veterinarian. Interesting. And then you graduate and you're like, I did it. I'm a veterinarian. And then you have to do it, which is different, right? They can only teach you so much in 4 years. There's no way to learn everything. Specifically for a mixed animal veterinarian, there is no way to learn everything you need to know about, we'll call it 9 different species, but it's more than that. There's no way to learn it all. So they have to teach you how to think like a doctor. They have to teach you how to problem solve like a doctor. And then you go into situations, analyze, and make decisions.
I can relate to that, at least in architecture school. The point was not to become the greatest architect with all this knowledge and stuff, but the goal was to learn how to process the thinking, right?
Yeah.
Learn how to be a student, learn how to learn to be able to communicate that knowledge, rather than saying like, here, we're going to teach you how to build a building, because you can't do that in school. You can teach concepts. So I think that's really interesting. So you said mixed animals. So what does that mean? Like, what's the range here? Are we talking about, horses and donkeys? Or are we talking about, like, we just said fish. So I want to know, like, what are the things that you come across or you have trained in, or
Sure.
whatever?
So, the major categories that I was trained in would be canine, dog, feline, cat, bovine, which is cattle,
I was like,
small ruminant, which is going to be goats and sheep, horses, which is horses. The fancy word is equine, I guess, since I've been using those the whole time.
Yeah.
And then those are really the big ones. You can do extra training in things like zoo animals, exotic animals.
Oh yeah, I was gonna say,
you
could
could
teach
do
you that?
You could choose to do some of that. Yeah.
Like
So you could do
giraffes,
some
come
in
on.
fish. You could do some in like pocket pets. So like a sugar glider, a hamster.
Are those legal?
Yeah.
Okay, I thought they were.
Some of that depends on where you are, like what state you're in.
That's really cool.
But yeah, so for me, it's dogs, cats, and then farm animals mostly. But I did amputate a toe on a rat once, so that was interesting.
Oh.
Surprise!
Wow, amazing.
So what is the difference between like human medical school and being like a human doctor versus being a veterinarian, and like what are the similarities?
Yeah. So I think the similarity is that we are both a doctor, right? So we both see wellness exams. We both diagnose and treat disease. A certain subsect of us do surgery. The difference, and I think personally what I think makes veterinary medicine more challenging, is that a human doctor does that on one species. Your differences are going to be male, female, and then between ethnicities, there's certain diseases that are different. For me, well, okay, and the other thing is you can specialize in, like, you can be GP, so you can be a family practice doctor, kind of look at everything, or you can be, I do just eyeballs, I do just teeth, I do just surgery.
Yes.
As a veterinarian, I am the surgeon, I am the ophthalmologist, I'm the dermatologist, I am the neurologist, I take general appointments for 9 different species, right? So if I had wanted to, I could specialize. I could be just a veterinary ophthalmologist and see only eyeballs all day long. That would be horrific for me. What I love about what I do is that it changes every day. There's a little bit of everything. And that for me is not only within the body systems, right? Looking at eyes, looking at skin, doing surgery, but it also across species.
That's really cool. I mean, I think that's really cool.
Yeah, but the best parallel I can make to like which human doctor is most like me would be a pediatrician.
Okay. Yeah. Okay.
And why is that?
a pediatrician, a parent has to bring you a child because they're concerned about the child because something's wrong with them. And for me, an owner has to bring me a pet because they're concerned about something.
Right.
The difference there is most children can still tell you, my arm hurts and it hurts right here. And yes, I did whack it on a tree.
Right.
Whereas my patients don't talk to me. I have to figure it out, which is part of the puzzle, which is part of what makes it fun. But there is also kind of a similar emotional attachment, which I know we have talked about before.
Oh yeah.
Between an owner and their pet and a parent and their child. So a lot of people, you know, if they don't have kids, their pets are their kids. Or like for me, I live in this town with just me and my dog, right? So he is my everything. Aren't you, you handsome little boy?
He's wagging his tail.
He wagged his tail. He was dead asleep before that, by the way.
You know, I like that you made that conclusion or the comparison, because I often find that, you know, human medicine, at least I perceive it as complicated because we have a human connection to people. There's an emotional connection. There's a more specific way to describe what we're dealing with, and we create, you know, memories and all this other thing that makes it, you know, hard to go through suffering and loss or whatever. But I would imagine that, like, your ethics and your desire to be around these animals creates similar feelings,
right,
to make you become the better doctor that you are.
Right.
Do you find that, though, because the cow cannot tell you what's going on, it makes it more complicated with your client, not the patient, the client, and that, if anything, you know, how are people creating advocacy and agency for the pet,
sure,
you know, or the animal? You know, what does that mean?
So sometimes it's twofold. Sometimes the owner has to advocate for the pet, right? So you have to bring them to me and tell me that you think something is wrong, and then I will investigate.
Right.
Sometimes there can be a situation where you don't feel your veterinarian is looking hard enough and you have to advocate for your pet. No, I really think that there's something wrong. I really think that we need to do more.
Yeah.
But on the flip side of that, sometimes it is me who has to advocate for the pet. So no, we really need to run this test. There is something wrong, and this is how I'm going to figure out what is wrong. And occasionally the very difficult advocacy that I have to do is, this animal is suffering and we need to choose to end that suffering with euthanasia.
I can imagine that is really challenging.
Yeah. When I was younger and thinking about being a veterinarian, that was the thing that I was like, oh, I'm going to be a vet, but I'm just like never going to euthanize pets. That would be too sad for me. And now I really, truly believe that it is the gift that I can give to an animal. I can make, so the word euthanasia, the definition, what it means is good death. So I can make it quick, painless, and I can end your suffering simply and completely. There is no question at the end of that you are no longer suffering. And it is something that I can do both for my patients and for my clients, because no one would want their animal to suffer. And, sorry, I lost my train of thought there. No one would want their animal to suffer, and neither would I. So it is something that we can do for them. So yeah, advocacy can be interesting. And then you think about it from the large animal side of things. So from the food animal, production animal side of things, then we have to think about things like welfare, because those animals have a purpose, right? We are creating a product for human consumption. So in a dairy cow, that's going to be milk. In a beef animal, that's going to be meat, you know, along those lines. But we have to make sure that we are treating those animals with the respect, care, and love that they deserve, because that is still a living creature, and they still deserve our respect. But I will tell you that of all of the farmers and producers that I've ever met in my life, I honestly cannot think of any that wouldn't fight harder than anyone else for the welfare of animals.
Right.
That wouldn't work even harder than is required, which is something that I think there's a really poor perception of in the public eye, that like farmers are horrible to their animals or that they don't care about them. And it's just not true. It is, if you break it down to brass tacks, it's their livelihood. Why would they do anything to that animal that would make it produce less and thus make them less money? It behooves them to make that animal as happy as it can be, so it will produce as much as it can. But also, no one loves an animal like a farmer. I guess maybe a veterinarian, because, you know, plug for my existence.
I can imagine, though, like on that flip side of the coin is that you end up having defending farm life and farm
all the time,
you know,
every
environments day. And your job and the work that you do, because there's like really a lack of education. Because I mean, I came across someone in college who literally had no concept of where their food came from.
Oh yeah, there's lots of people like that.
And thought that they got the food from the grocery store and that there wasn't a process in between growth and like transfer. So I can imagine that there's misinformation being spread about
so much
what farm life entails and like what does a dairy cow go through on a daily basis, and like how do you get beef cattle and like the process of that. Which we don't have to get into because I know that can be political, which it shouldn't be because it's literally how we survive.
Yeah, I'll just do a quick note though, that like I said, that no one's gonna love an animal like a farmer. The same goes with a veterinarian. It is my obligation as a licensed practicing veterinarian to care for the welfare of animals.
Right.
If farms truly were horrible, like groups like PETA want you to believe, they wouldn't exist. We wouldn't let it happen.
Sure.
And I just really wish that people would think about it a little bit more and would look for information further than just the clickbait that's on Facebook.
Right.
Because my people in my industry receive a lot of hate.
Right.
That's do you just get tagged in things like all the time?
Kelly, look at this.
Yeah.
So what's one thing that you wish like every pet owner knows? And it doesn't have to be about agriculture or anything. It could just be about like caring for an animal.
Sure. One thing, I'm gonna back it up a little bit. One thing I wish everyone knew before they got a pet is that when you sign on to get that pet, you signed on for the whole life of that animal. So we're talking, 10 to 20 years sometimes, depending on your animal. And the amount of effort it takes for a little puppy, everyone thinks little puppies are cute and fabulous, but you don't think about that it's not potty trained yet. So it's going to pee on your floor, and it needs to go outside every 2 hours because it's literally 3 months old and can't hold its bladder. It doesn't wear a diaper. It can't just pee in the diaper. So it takes a lot of work, and people don't think about that. And then, for the middle part of their life, they're great, right? They're your best friend. They're your companion. They're well-trained. Eventually, they're going to get to a point where maybe they get sick, or maybe they just get old and can't control their bowels anymore. You signed up for that the day you took that animal home, and that is not only a time commitment, it is an emotional commitment, and it is a financial commitment. And that is something that I know Emma knows very well.
Yeah.
A few years ago, she was thinking about getting a pet, and the kind of qualifier I tell all my friends that want to get a pet is, but could you hand me $2,000 to $5,000 right now?
I was like, what do you mean?
Because
I just want a dog.
Right. But if you think about when your dog eats a toy whole and it gets stuck in its intestines and it's 2 a.m. and your dog's vomiting and looks horrible and looks like it's going to die, and you rush it to an ER, we are more than happy to save your pet. Absolutely. We will do that for you. We will fight tooth and nail to make sure your pet is okay. But unfortunately, we don't live in a world where veterinary care is free. And to do it at 2 a.m.
and insured,
right? Wow. Because that's a great point, Lauren. Because people compare it to human medicine, right? So like you go to the doctor, they do all these things. Eventually, a bill comes to you for $40.
Yeah, or your prescription is after insurance, $20, $70, whatever.
Yeah. Mm-hmm.
But I can tell you when I take my cat to the vet, oh my goodness, right? Like,
Yeah.
It's astronomical
Mm-hmm.
what I pay for
Right.
my cat.
Right. But if you
pay for your cat.
one of my absolute biggest pet peeves in life, and this is controversial, it irks me to the core, is when people who are not financially stable get pets on a whim.
Yeah.
Right? Or they're it's like your college friends who can't give you the $20 that you lent them back, but they just bought a dog. Like, something is not adding up here, and it makes me so angry, because when you were talking about that middle part of the life where your pet is your best friend, that's all great and good, but people do not realize that that's not just like 3 to 5 years.
Yeah.
Then your life is going to go on. That is a decade.
Like Christmas
For
puppies.
most dogs and cats. When I was 10 years old, and when I was in 5th grade, and I turned to my mom and I said, "Hey, can we please get a cat? Pretty please." I didn't think that cat was going to be living with me today when I'm 25 years old,
Right.
sitting in my own house as an adult. What I was going to do with my cat while I was in college never once occurred to me when I was 10 years old, right?
Right.
And the core of that goes to, there's actually debate kind of in veterinary medicine that is having an animal a right or a privilege?
Oh,
What
sure.
would you say? Quick, off the top of your head.
It's right.
Lauren?
I think it would be very much a privilege, right? Because if you can't
Guys, I'm dumb.
if you can't financially
No.
and care for that animal with your
Yeah.
social time and with
Mm-hmm.
time and money, then
Yeah.
you
It's
shouldn't
very much
have
a
it.
debate, though. So, like, don't feel bad, Emma, because there are people in my industry on both sides of this. I don't want to say argument, but this question. I personally think that animals are a privilege, the same as I would believe that having children is a privilege.
Oh, sure.
You have to take care of that animal.
And
You are responsible for a life,
Mm-hmm.
and the question about is it a right is they're focusing on the emotional aspect, right? Do you have the right to the companionship and love that you find through a relationship with a pet? And I can empathize with that completely. I wish that every person could know what it's like to have a pet, to have someone happy for you to come home every day, there for you in every moment, that just loves the snot out of you more than they love anything else. But you have to take care of that animal. At the end of the day, you have to choose that animal above a lot of other things.
Yeah. And I think people forget that. Just I think about people I know who, they don't realize that their job is gonna suffer at times because they have to let their new puppy out, or maybe you're a student and you're studying and the dog is crying and because the door is shut, and that's frustrating, and that changes. Or I can imagine that when you get to that older age and the dog is suffering in a normal way. Okay, take that. Not suffering, just like it's old.
Aging.
It's aging. It becomes to the point where you're like, well, this is complicated and I don't really want to deal with this. But like you said, they signed up for that. And that's important to be there and to support that animal.
I totally agree. But a lot of people have different thoughts on that, right? And people have different thoughts on just what pets are in general, what your responsibility is to a pet. Because do you view it as a part of your family, or is it a dog? Or does it serve a purpose? Is it a hunting dog? Is it a guard dog? Is it just a farm dog that showed up in the shed and just you feed it?
Sure.
Because that's a very different motivating factor. So when my clients come in, I have to try to figure out which of it is, or sometimes just ask, what is the goal here? What is your perspective? Because certain people will do the whole nine. I mean, they'll go to the university for a CT scan and an MRI and do brain surgery and all kinds of stuff, and that's wonderful. But not everyone values that animal the same. Which there's no right or no. There's there's a sliding scale, and that's normal. I will say there is a wrong way to evaluate an animal, and that would be to not value the animal at all.
Sure. Okay, I want to lighten it up a little bit.
I have a super pressing question.
Okay, I'm ready.
Are you sure?
Yeah, so ready.
Okay. Have you ever been bitten by a duck?
Oh,
so specific.
Hold on. Oh my God, yeah. Actually, I have.
Really?
Okay,
Yeah.
follow-up question.
Oh God.
What did it feel like?
Like being bitten.
Or like, what does a duck's beak feel like? Is it like a chip clip? Like, is that the energy that we get from
so like being bitten was
like when a duck bites you?
Yeah, it was like a really intense pinch. And so much, honestly, what I remember is like shock. Because there's like certain things that you expect to bite you, and a duck is not one of them.
Oh, sure.
So it was just
That makes sense.
I don't even know if it really hurt as much as I feel like it hurt. Because you know how sometimes you like hit your hand on something and it didn't hurt, but you're like, ow.
That was
Yeah.
Yeah, and it like didn't hurt, but you just like but I mean,
So what does the beak feel like?
I would equate it to like kind of what your nails would feel like.
I don't have
Oh,
nails.
really?
I need to touch your nails. Slimy.
Ew.
No, I'm just kidding. it's like I don't know.
Soft.
It's
but, like,
soft.
hard. Yeah, it's keratin. You know. Yeah.
What's keratin? You said what did you call it?
Keratin.
Keratin.
Yeah, it's a. Ooh, I don't know. It's a peptide, I guess. I don't know how
It's a
to. answer
peptide.
this.
Okay, we're going too deep. Back up. Okay, we got bit by a duck.
Yeah.
Okay.
I've been bitten by a lot of things in my life.
I have another
I
question.
got bit by a cat the other day. She came home and she told me
did.
about it.
Yeah.
Really? Yeah.
It bit me on my middle finger too, which is
Oh
funny.
no.
It's okay. I'm rabies vaccinated.
I have another question.
Okay.
Are you allowed to prescribe medicine for your own pet?
Yes.
Really?
Yeah, I am my dog's veterinarian.
But like, it's not free.
Okay.
No, it's not free. I pay for it.
And,
I
like,
was just thinking,
yeah.
like, because aren't
Yeah, 'cause a
doctors like
human-
not allowed to
yeah.
give themselves prescriptions,
And
right?
like can't be family members. Doctors couldn't operate on a family member. I think that surrounds what we think of as human rights and what we think of as like would compromise doctor's integrity.
Okay.
And legally, animals are property.
Oh, right.
Yeah.
Okay.
That's just interesting, though, that like you could write a
Mhm.
prescription and just take it home with you.
Oh,
But
every day.
Is that controversial? Because like, what if you kill your dog on purpose?
Well, it's like, well,
and then you blame
also
the
like,
company.
Yeah, so
and then
you
sue
have,
that
like-
company.
you're relying on
but
the
also like
ethics
you
of
have
the
access to
person.
medication that could like
Yeah, I do.
put a cow down, right?
Yeah.
Like you could kill a very large animal. You could easily like.
Yeah. Kill a person.
like,
Is
that's-
that
But,
what you're getting at?
I'm sure that's true for any doctor and
That's the
any
thing, that's like
pharmacist or
doctors.
whatever.
They could do
Yeah.
the same thing, but like she's got ethics to uplive, so
Yeah.
she can't just like kill
the
something.
the different ooh, this is dark. The difference
I'm so
is-
sorry.
No, it's okay. The difference is I have all of those things in my truck in the garage because I'm a large animal vet, so I have to take my supplies to the animal.
Oh,
They don't
with you.
come to
Yeah,
me.
yeah, yeah.
So,
It is locked, by the way.
and my house is locked. Do not come to my house.
Right. So back off. Also, she's very safe. But I did get to see inside of the truck once, and there's lots of things in there that are very scary. There's like a
Oh my
needle the
goodness.
size of like my calf.
Yeah, that's
like
true.
it's huge.
Okay, not like the
Oh my
thickness of her
gosh.
calf, but
No,
like
just
the
the
length.
length.
Yeah, it's
It's
called a
so-
Buhner needle.
It's huge. And
Look
I was
it
like,
up.
what do you stick with that?
Yeah.
Do
Look
you
it
have
up,
any like
anyone?
crazy stories, like funny or just like?
Oh yeah, that'd be interesting.
Yeah. Okay, like crazy, like it was like a medical conundrum or like this was whack.
yeah. Kelly did have her arm, elbow or shoulder deep inside of a cow once.
Once I do it every day.
Or the bowl, was it? I tell my friends that. I go, my friend Kelly's a doctor. And she puts her hands inside bowls.
Okay, so what you need to know is that part of being a large animal vet is preg checking animals. So checking to see if a cow is pregnant or not.
Okay.
And the way you do that is you rectally palpate. And I'm only 5'6", so my wingspan is not that long. So it takes my whole arm. She makes it sound like I just like, I don't know.
I don't know what her
Do it for
day-to-day-
fun on the
I
weekend.
don't know
Yeah,
what
like,
her
it's
day-to-day
my
looks like.
job.
What's your day to day? Like,
Okay, my day to day, like the schedule, like.
well, I'm just curious. Like, what's something that you?
What are like common appointments, or like
Yeah.
how many animals do you see a day, or whatever?
Oh, so it changes every day.
What's like this? What's something that is consistent? Like, do you have to do something?
Oh, like something. Okay. I leave my home at roughly 7:20, and I arrive at work at roughly 7:30, and that is the only part of my day that's the same. every day.
Okay.
And like that sounds like a joke, but it's really true.
can
Because
imagine.
sometimes I see small animal appointments right away.
Uh-huh.
Sometimes I do surgery. Sometimes I go and do my preg checking. Sometimes there's a goat that needs help having her babies. Sometimes I catch up on writing my records. So it really changes every day, and that's some of what keeps it interesting, keeps it exciting. It can also be difficult. I like to have a plan. I like to like know what's coming
Yeah,
to
like
a certain extent.
schedule.
So sometimes it's really annoying when I get my mind wrapped around like, okay, so I'm going to see these 2 appointments, then I'm going to go and do those 4 surgeries, and then it'll be lunch, and then after lunch I'm going to do this, and then the phone will ring and it's like, just kidding. And my day can look totally different.
Sure. For being a farmer vet. Sorry, that was not smart. For being someone that works in rural areas,
Mhm.
do you have like a proximity that you guys have to like? Like how many miles? Yeah.
Oh, like how far do I go?
Yeah.
I guess I don't know what it really would be, because I've driven, I mean, like an hour to get to a call, but that's really far. Like we don't
Okay.
have very many like that.
Okay.
I would say most of my producers are within a 30 to 40 minute drive
and
from
a
where I am.
producer is the farmer.
A farm, yeah.
Okay.
Mhm.
Okay. Got it.
And then of course the small animal people come to me.
Right.
Usually, I guess, not always. But so
Right.
that would be the same for like when I'm on call at night. It is for our clients. So
Mhm.
that same radius.
Would you say that you're busy every day?
Yes.
Okay. That sounded like a desperate call.
And you're probably on call quite like
Yeah, right now
Most
there's
of
2
the
of us
time.
covering on call, so I'm on call 50% of the time. So
Okay.
2 nights a
Wow.
week and every other weekend.
Is that stressful?
Yes. It was much more stressful when I first started. It used to really scare me, like
Right.
to the point where, okay, overshare. I used to be scared to like take showers when I was on call, because I was like, what if the phone rings while I'm in the shower? And then I
Right.
answer the
Well, I
phone.
can imagine, especially being a first time out of school vet. You know,
Mhm.
you're like, what do I expect? How fast do I have to get there?
Yeah. Yeah. Well, and then
Is
it's like,
it
what
often?
if I don't know
Like
what to
how
do?
often would you get like an emergency call? Like once a year, like every month?
It that's cute. It really varies based on time of year.
Okay.
So like we are moving into calving season. I will likely
Ooh.
get a call every time I'm on call. So every
Because
Oh,
every night,
wow.
every
there's
time.
a baby being born.
Mhm.
Oh my
Yeah.
goodness. So then you're
Um,
really like fast showers.
Yeah.
Or no showers.
Yeah, I've
I
gotten
don't know
over
what she
that. I
does.
take
really
showers.
don't know.
I'm over it. I take showers. I mean, I always did, but like, I'm not scared of them anymore.
Scared to take. Kelly's scared to take a shower, but she's got her arm elbow deep inside a cow's ass. Got it.
Well, because when you're new, you're like, but what if I don't know what I'm
Yeah,
doing, or
yeah.
you just get nervous. But
That makes sense.
I have been doing this for almost a year, and I by no means know all of the things, but I'm much more comfortable doing things that I'd never done before, or like
Sure.
don't know quite what to do.
Mhm.
And just like puzzling my way through. I also have really excellent mentors that never.
I feel like you can't not have them.
Oh yeah. But they, always answer their phone no matter what time it is, and help me and guide me through it. Or when I'm like, no, I just really need you to come and,
Just like
and
tell me
do
what
this.
it's doing.
They
just
they
help.
come. So
That's
um,
very cool.
yeah, really lucky to have good people, because you can only learn so much in school, right? There's no way to be taught everything. There's no way to think of every scenario that could ever happen.
So you do surgeries. So like,
All the time. I love surgery.
okay, what's a typical surgery? Because I assume like, like dogs get, their, they
their testicles removed.
Yeah,
yes.
I almost said the balls cut off, but I wanted to be more appropriate. But yeah, like that is a common thing, and I assume like, you know, if someone gets something lodged in their throat, you know, you kind of go in there. But like, what's something that's really easy or not easy? Sorry, very routine, common versus like really complicated that you've worked on.
My favorite routine surgery is a cat spay.
A cat spay. What is a spay?
It's my. Oh, I'm sorry. That is. It is sterilizing a female cat, so making it so she cannot have babies anymore. So I surgically remove her ovaries and her uterus.
All right, everybody.
So
that's on the low scale of what Kelli does.
It's my favorite. It's my zen place. When I'm stressed, I just think about the steps to a cat spay. It's beautiful. I make like a 1 centimeter incision in the abdomen. Takes me roughly 15 minutes.
Oh my gosh, this is insane.
I'm like, I do math at work, and that really makes me
handle
feel
this.
great. I love it when I go to a school and work on buildings.
Let's sway from talking about surgery.
Well, I want to know. I want to know like if she's done like a heart surgery. I want to know like if she's done other things.
Did you say heart surgery?
Yeah.
Oh no, that's terrifying. There are people that do that. There are veterinary cardiologists. Things that I will never, and I mean never, touch with a scalpel, a heart and a brain. Those are the two things that are keeping you alive. I'm not touching it.
Okay, so that's where it gets more complicated with other doctors that are...
Specialists are going to do that.
Okay, cool.
But
which
like kidneys, livers,
Yeah,
intestines, whatever.
Yeah, I'll touch intestines all day.
Is anything ever like...
That sounded so strange.
That was great. That we're keeping it.
Oh, okay, we're going to keep that. It's going to be our little, cash grab. So, I know like one time you amputated a cow's toe. And that was just because there was like some bacteria.
Okay, can we just like not talk about it though? Like,
I
don't want to talk about it.
Describe it. I just want to know, like, I'm assuming
the like coolest one. I've ever
just
done.
saying the descriptor was
Get
enough for
over
me
yourself.
to not.
Tell me.
The coolest one.
I want to know.
That I've done or that I've seen.
I want to know what you've done. I don't care about other people.
Okay, what I have done. I mean, I've delivered puppies. That's really cool.
That's amazing.
It's not complicated
but
at
that's
all.
Cool.
But it's cool.
Is there anything you haven't delivered? I assume you've delivered a cow.
Yeah. I haven't done a horse yet.
Oh, that would be interesting.
Yeah. Okay, but hardest surgery I've ever, or the most complicated surgery I've ever done. I guess at this point in my, a double enucleation. I removed both of something's eyeballs. That's all we'll say.
See, this is why I did not want to talk about it.
I just needed to know her skills. I didn't need to know how she did it or what it looked like. I just want to know her skills. Amazing.
His name was Bebop. Shout out to Bebop. He's
Shout
the
out to
background
Bebop.
on my work phone to this day.
See, that's all I needed to know, Lauren. We can move on. I just wanted to know.
Lauren's traumatized
Lauren
because
is
you
traumatized.
cannot see her
I
face.
can't.
Not okay.
I'm an engineer.
Lauren was traumatized in the last episode, so we're doing a good job.
Yeah, this is like really. This
Lauren's
podcast
being
is turning
abused
into
in
a
our
hostile environment. Emma's over here like, I don't care what you feel, Lauren.
We're getting deep.
Okay, can you just tell us a funny story, please?
Oh yeah, what's something comical? Do you know anything funny that like do people ever like make you like go, what the heck is wrong with you? Roll your eyes.
Oh yes. So in a really beautiful way, right? People always have the best intentions, but multiple times I've had people come in because there was like a tick or something they thought on their dog.
Okay.
And they'll be like, I can't get it off. Like I like pull on it, it won't come off, or like I pulled and I got it off, but like now she's bleeding. It looks really weird. And I'll go into the exam room and be like, okay, like show me where it is or whatever. And they'll point at a structure, and I will work very hard to make no expression at all and point at the same structure and be like, this right here. And they're like, yeah, you just can't get it off. And I have to try to come up with a diplomatic way to be like, that's your dog's nipple.
They tried to remove a dog's nipple?
Yeah, I've seen one person just rip her off.
What?
That's the one that was bleeding.
And you thought the eye was bad.
And then you have to like have a conversation about how like, yes, boy dogs also have nipples, just like boy people also have nipples.
Oh my gosh, people
Fun
are just
fact,
wilding out.
male rats do not have nipples.
Oh my gosh, see, this is the
Oh,
knowledge I
hey,
needed
good to know.
for telling me about
But
nipples.
yeah, it's real cute, honestly, so long as they have not like physically ripped a part of their animal off, which like
That-
only happened once and they felt really bad. But
Well, I can assume that that's just scary.
it's
but
yeah.
why are people trying to? All right, that makes sense. Okay.
And also like it's flesh colored. Like I don't understand.
like, how did you miss that?
Yeah,
How
I don't
did you
know.
miss
Whatever.
that?
Oh
It's
my
cool.
gosh.
Do you ever? I can imagine though, like clients will come in with their pets and be like, something's not right, please fix it, and you're like, ma'am, the dog's sneezing, it's allergy season or something, like,
Yeah, all the
it's
time.
just it's overly
All the time.
unsure.
Sometimes though, those are the best because those are the people that you like saved them, right? They thought their dog was dying, and you tell them to give it Benadryl, and they'll call you and be like, "You saved my cat." And like,
And you're
those
like, yes,
people
I'm
love you
amazing.
so much. I have the best relationship. This client I saw when I was still a tech. This is a long time ago now. To this day, will tell people that I saved his dog's life, and I did exactly nothing. When I tell you I did nothing, I mean I like carried the dog inside, rolled it over, and then we sent the dog home.
Is that the dog that was like bleeding, but then it wasn't?
Yes, yeah. So Emma has heard this story.
This is
So
funny.
the short version
Not
is
funny.
the dog had surgery, then was running around in a yard, which is a no-no, and he then called in and was like, "There's blood everywhere. The stitches are all out. Oh my god, he's freaking out." So I was like, "Okay, yeah, you need to get here now." I'm in the parking lot with a gurney ready to carry him inside. I've got the surgery room all prepped. I told, because I wasn't a doctor then, so I told the doctor like, "Hey, this is happening, and when you hear me knock on the door, you need to come out because I've got the dog." So I grab the dog out of the car, I go running inside, set her on the table, bang on the door on my way past. The vet comes in. I roll the dog over, and I realize that there is no blood on this animal.
Oh my
None.
gosh.
And the stitches are perfectly intact.
What?
So
Where was the blood?
So what we think happened is she just like dropped a little clot because she was playing right after surgery, which she should not have been doing. So like that's what we think happened, but it was just so cute.
So you were like, here's your dog back. Everything's
yeah,
good.
this man's like,
and they were like, oh
genuinely
my
in
goodness,
tears,
thank you so
thought
much.
His dog was gonna die, and I got a pet sitting gig out of it.
Amazing.
And-
She got a job. Brilliant.
Yeah, and like a great relationship with this client, and to this day he tells people that I saved that dog's life.
Amazing. See, that's what we love.
When I
But
tell you I did nothing, I meant that I did
Oh
absolutely
my
nothing.
goodness.
I'm sure there's like some reassurance in that, you know, like you were talking about earlier about euthanasia. It's just like there's some reassurance that like you're going to help me and my animal. You're going
Yeah.
to do what you can no matter what. And
Yeah,
you
I'm
know.
always gonna do the best for your pet
right, right,
or animal if it's a cow or
right.
a goat or
Not to be depressing, but I'm gonna be depressing.
something. Okay.
Do you see a lot of death? Like, do you come across a lot of like needing to put animals down or animals die because of complications or?
Yeah, I mean, so like less so of things just like just dropping dead in front of me. I don't think I've ever seen that, but yeah, certainly I euthanize pets at least every week.
Mhm.
And there are times where I go to a calving or something where mama's been trying for too long, and I can get the calf out, but the calf's dead.
Oh yeah. Okay.
But if I wouldn't get the calf out, mama would die too. So
Do you feel sad ever because of it?
yeah.
It's just like I can't imagine you're not sad, even if it
Yeah.
was, expected.
Yeah, so I hate when babies of any kind are dead. Like I finally get it out of there and then it's dead. You're like, part of you is like, okay, that's really sad because an animal is dead, and also that sucks for the producer because he wanted a live animal. But also, I just worked so hard, and you're dead.
Ugh.
So like that kind of blows.
Yeah.
But on the small animal side of things, it's sad. Like you see people in what is arguably one of the worst moments of their life, and it's, if you've ever gone through it yourself, it will always remind you of the pets that you have had to say goodbye
Sure.
to, and sometimes they're gut wrenching. I mean, you get so attached to some of your patients
Mm-hmm.
that I am not above I can think of one specifically a few weeks ago where the owners were sobbing and so was I. I was full on crying along with the family because I fell in love with their dog and I worked so hard to try to save him, and they had they have like a 3-month-old baby and a 3-year-old, so we had to have a conversation with the 3-year-old about death and euthanasia and trying to get him to understand it. And it is heartbreaking to watch a child try to deal with that because they're so pure. They're so pure because we talked about that. We don't want.
That's so nice that you talked to the 3-year-old too.
Yeah, not every vet will do that, but I like children, 1, and 2, I think it's important that conversation happens, and a lot of times parents need help with that conversation, and I'm happy to try to do that. But kids are just so pure. I mean, this little boy, we talked about that we don't want his puppy to suffer, right? Because we love him, and he like throws his arms around the dog's neck and is like, yeah, I love you. And
depressed.
So I'm gonna cry thinking about it.
Don't. Okay.
Oh, don't.
Yeah.
Okay. I have more questions for you.
Yeah.
Okay, Kelly, since we're best friends.
Yes.
Just stick it in.
We're since we're friends, but we never text each other, or we're like
we just know.
I am like your hype girl from a distance.
Yes,
like
that's
I
so true.
I am your Facebook friend, right?
Yeah.
Like, gosh darn it.
Yeah. But like the forever positive, I totally the facts.
The support.
So could I hypothetically 2 years from now text you a question about my cat, or is that rude? Like with no prompt. Like I'm not gonna say hi, how are you? I'm just gonna be like, hey Kelly.
Yeah, you can. There are definitely
Okay, good. That's all I
my-
needed to know.
My dog just came out because
Can we talk about this for a second? This is the 3rd time this has happened since I've been here. Dooley can't be left out of joy and laughter. So he literally came out.
No, okay, stop. He has FOMO, okay? So if he hears you laughing and he's not in the room, he will come to wherever you are.
It's like, why are we laughing?
Because he feels left
Hi,
out.
buddy.
It's just genuinely really cute.
Okay,
So,
sorry. Yes, please text
yes,
Lauren.
yeah, you can text me about your cat, but
Thank
certainly
goodness.
something that I think the general populace should know is that, like, no, don't text the person that you met 15 years ago that is a veterinarian anything about your pet. Specifically, if when their answer is yes, you need to take it to a veterinarian, you're going to be sassy, rude, or not take their advice.
Right?
Because actually
don't
up
ask
yours.
me if you don't.
Yeah, it can be very frustrating even with people who I would say are allowed to like ask me questions when they don't take your advice. And then
That's
like
annoying
3
and
days
regular.
later,
Got it.
they're
I
like,
promise to take your advice. I
Thank
trust you.
But I actually jokingly with a friend, this is like a year ago now, came up with the perfect reason, the way to like weed out the people. And Lauren, you're an exception to this, so like don't feel bad.
Okay, thank
But
you.
the
I
best
already
thing-
feel bad.
There you go,
the
Lauren.
best thing I've ever thought of is like if you're thinking about asking me a question about your pet, there are 2 questions that you need to be able to answer. First, what is my middle name?
I know what your middle name is.
Yep. So you could
You
but
do?
this other
Yeah.
part you might not know. And second, why is that my middle name?
Oh,
Oh.
I don't think I know that.
Right. So there's like
I know the other half of your name.
Right. So there's
See,
some
Emma doesn't even
exceptions
know
to
it,
this.
so-
right. There's some exceptions to this, but this is how we weed out the people that my mom goes to church
Yes.
with who
You need a rule of
know
thumb.
that I'm a veterinarian. Yeah, a little bit. Because like people who know me well, also like the first one, you have to be my Facebook friend, right? And then you
Oh,
can get the
yeah.
answer to that.
You have to be good Facebook friends,
Yeah.
like Kelly and I.
Like my stuff.
You really don't know why my middle name is what it is. She's gonna.
You
call
guys are gonna have to talk about this
the
offline.
person who is the reason is going to call you and be like, "Baby girl, you wrong. The baby girl was your hint just then."
Wait, I know mom is the second half of your first name.
Mm-hmm.
Is that her middle name?
Mm-hmm.
Oh,
now you just told all these people the answer.
I don't think anybody knows who your mom's name is.
There we go.
That's true. Also, I'm sorry, Mom.
Yeah. So
Hilarious.
now I want to explain it, but whatever. None of these people are ever going to ask me. So my name is
Don't
Kelli
text
Ann.
her. Only I can text her, okay?
Exactly.
I might need this later.
My name is Kelli Ann Elizabeth Bowman. That's my like government name.
Sorry.
And
Illegal.
my mother's name is Ann Elizabeth Bowman.
I didn't know the Elizabeth part. I knew it
Yeah,
was
so I'm named after my
Anne.
mom.
Kelli
Shout
Ann.
out to Mom. Hey, Mom.
What did that's a question for later. Never mind.
Do you want to know something really excellent that has nothing to do with like me being a vet?
Yes, please.
I've asked my parents why they named me what they named me, and they literally have no idea. And it's
Oh.
genuinely so obnoxious. My sister is named after like two of our very beloved family members. And I am named after a waitress that they had once that they thought the name was pretty.
Oh
And my
my
middle name is
gosh.
Elizabeth because my mom doesn't think anything else sounds good with Anne because she has spent her entire life hearing Anne Elizabeth.
That's so funny.
So,
That's
Thank
a
you,
cop-out.
parental units, for not putting any
10 out of
thought
10.
into
10
my
out of
name.
10. That's so funny. I have a question.
That was a fun little segue.
If there was a I'm avoiding this concept. If there was a little child out there right now looking to be a veterinarian,
I wasn't sure where that was going.
I didn't want to go the other direction. What would you give advice about?
It's hard. It's really hard. So you have to be ready for that. It's a lot of school, but like I said before, it is easily the hardest but best 4 years of my life. I made amazing friends through that process. We like to joke that we were bonded by our collective trauma.
Lauren and I were bonded by our collective trauma last week.
But yeah,
So
I mean,
true.
my recommendation would be.
Sorry.
No, you're fine.
Compose yourself.
Oh.
I'm gonna tell Kelly this later.
Okay. Okay.
Collective trauma.
Anyway, we're just gonna like blaze past it. I would say you need to shadow veterinarians. You need to
totally.
spend time in a
Yes.
clinic, really figuring out what it's like.
Be involved.
Yeah, because I think there are a lot of people that like think it would be fun. The idea of it is fun, but
sure
don't
people-
understand at all what the job is.
Well, I'm afraid of blood. Kelly
would not
knows
work
that.
for you. Yeah.
So-
We're out.
But I'm not afraid of needles. Fun fact.
Good for you.
Anyways,
Get
That
that
makes-
vaccine.
I will.
There's a plug for the COVID vaccine, folks.
Please get your COVID vaccine.
Herd
Yes,
immunity's a thing.
We don't care if you agree with us or not. Okay. Anyways, do you think that like it's important to make that known? You know, like sometimes there are professions that people go like, you know, get into it and you'll find what works for you versus like, don't be a veterinarian if you really cannot stand the sight of throw up or something. Like,
Yeah,
you know.
and also don't be a veterinarian because you don't like people, because 90% of what I do all day is work with people.
Right.
Yeah.
Because you have to communicate that.
Oh, that's so smart.
Yeah,
You think, oh, I'm
right?
just going to deal with the animals, but really you got to deal with the
Yeah, I deal with people
Emotional
all day long.
owners.
The only place where that works, and I 100% am this person, I don't think
when you're
I
in the
would've-
back,
Yeah.
cutting the boxes, listening to our podcast.
Yes.
I'm sorry.
I don't think I would have liked being a human doctor because I love surgery so much, but I think it would seriously wig me out to like do surgery on a person and then be like, ew, that's what my intestines look like.
I can, that's
Because
Yeah,
at
but
least for
can't,
me,
like-
I'm like, that doesn't look, that's
Do
not
they
what
look
my
much
insides look
different?
like.
Like
I mean, no, but like those could not be inside of me, and that makes
but
me
it's
feel
so
better.
funny. Like when like so there are some similarities, like obviously with all the different species, but
Yeah.
like your cat and your dog still have a kidney and a liver,
yeah.
and when
Mhm.
when you
Yeah,
give
we're
them
all
medicine, you're
mammals.
basically just giving them like just this tiny dose in comparison.
Yeah, yep, it
to
can
a
be
human,
really
right?
similar. I don't know. There's something about it where that like
I feel you
this-
though.
If it was this could be me on the table, and that
Ugh.
wigs me
Oh
out.
no.
No,
right,
thank
that's
you.
what I'm
you.
saying. That wigs me out. When I'm looking down at a dog, I'm like, this is very clearly not me.
You know
I
what
love
happened when
dogs.
I was at the vet the other week?
Ooh, tell me.
My vet was like, "Oh, your cat is pale," and I was like, I didn't know that, like,
Is it
a
anemic?
cat, like something with fur could be pale. And she was
Well,
like, yeah,
so-
how did you not notice? And I'm like, it made me feel so bad.
So she
And
probably
she's
meant like her gum color was pale, not like her skin was pale.
it was like her like eyelid.
Yeah, her mucous membrane.
And
So that has to do with like how many red blood cells she has running around in her body, not how much like of a tan she has.
Okay, so like, should I worry about it?
Did they run some blood work?
Yes.
Okay. Not that I'm offering medical advice, but if the blood work was normal, everything's fine.
Okay, cool. And I felt like literally horrible. She was
Oh,
like,
no, sad.
did,
No,
did
why
you
would
not notice? And I was like, what do you mean? I
mean,
could
there's
never look at
certain
my
stuff-
cat's eyelids. Like,
They wouldn't even let us get that close anyway.
There's certain stuff where people come in and I'm like, you really didn't notice? Like, you genuinely didn't notice. And they're like, no. And I'm like, you ignored it. But no, that is not something that, like, why would you be inspecting your cat's gums or eyelids or whatever? But I've literally had a
Right.
patient
well,
that
plus
came in
like some
yellow.
people's cats are friendly and you can like touch them and my cat is the
Oh, she's
opposite
not
of
friendly.
that. where,
She's
like,
just like an old.
like my vet tries to
grouchy
give me
cat.
medicine and I'm like, you don't understand, this is not gonna like
Work
she's
out.
not gonna let this happen.
Sure. Yeah, it sometimes they
fun.
like medicine and sometimes they don't. Especially cats. Cats are so independent that they're like, if I choose to participate, everything's fine. If I have not chosen to participate, game on.
Exactly. Right?
Yeah.
So I'm always like, I'll try my best.
Yeah. And we get that. We know that there's limitations. And like sometimes I think we do a bad job of remembering that like I medicate cats every day, so it's easy for me.
Right.
But it's not easy for everyone else always.
Do you have more questions?
Do you have a favorite animal?
Do I have a favorite? Like ever in the world or like of my patients?
Like ever in the world?
Oh, a cheetah. Mm-hmm.
Oh.
Oh, that's cool.
Yeah, cheetahs are my favorite animals. I really like big cats. They fascinate me. Mm-hmm.
This kind of is like a reflection of personalities.
You think?
Let's get into
What's
it.
your favorite animal, Lauren?
A polar bear.
Oh, right. We were talking
And
about
yours
that.
is a giraffe.
Mine's a giraffe.
Yeah.
Why are we? Okay, I'm going to analyze that
See,
later.
I don't think that's
I'm not.
Well,
I don't
maybe
know
it
that
is.
I'm on that train, but we can talk about it later.
Anyways, Lauren, how do you feel about doing a wrap up, or what else do you think we should talk about?
No, I think this is a perfect time for a wrap up. Thank you so much, Kelly, for
Oh,
joining us. This has been a
yeah.
lot of fun.
Thank
I've
you
had
so much for having me.
So much fun, and I'm making.
I
it
learned a lot.
My goal in life to get all my friends on this podcast.
Yeah, but
because-
also specifically me many more times.
Specifically you.
Yeah.
I would love to get Lauren, you, me, Casey in a room. We could just talk.
Oh my god, we could talk about college.
Lauren would want to die. Lauren hates talking about college.
Oh,
It's the worst thing ever.
Kelly was over there like, I loved my time at college.
Yeah, I
It's
did.
great,
Like, I
great
hated
years, good
everything.
memories. And I literally, I looked at Emma on the Zoom call and I was like,
Oh, funny.
She was like, choke
that's fine.
me out.
It's
please."
fine. It's fine.
No, honestly, I think it's really interesting to just get some perspective, and of course, Cal, is there anything that you want to plug, like if anyone looks you up in the area?
Sure.
Or,
I mean, I guess you can look me up in the area if you're randomly listening from Southwest Minnesota. That's pretty cool.
also, thank you for listening.
My biggest plug is please remember to be kind to your veterinarians. We get a lot of people who are not very nice to us, both in and out of the context of this pandemic. But please remember that, right now most clinics are operating curbside. So you wait outside and your pets are inside with me. And I know that can be scary and nerve-wracking for people, but please remember that we are going to do everything we can to keep your pets safe and happy, and that we have to do that for our safety and for yours, not because we are trying to hide anything from you, but just in general, too. My industry gets a lot of, flack for that. Our services cost money. We get a lot of, if you really loved animals, you would do this for free, or if you really, really loved animals, you would help my pet. And I promise you that I really love animals, and if I could do it for free, I would. I just can't. So
Moral of the story is people
just be
respect
kind.
the position.
yeah,
Okay.
and I guess more broadly, like, please just be kind in the world. There is enough bad things floating around this world that you really don't need to add to it.
Especially with animals. Animals are animals. How dare you?
Yeah.
Amazing.
Yeah, that's my plug.
But we hope you have a great week, or have the week
Please
you
have
have.
the week
Please
you have.
like,
You have.
share, subscribe
Actually,
to this
Can
podcast.
I tell you that I have actually started saying that to people? Like, instead of saying, because Emma, I usually say like good night, sleep well. I have changed that to sleep how you sleep.
Ooh, sleep how you sleep. How the week you have.
Right.
We're not
like,
trying to enforce
no
anything on
no
you.
pressure.
No pressure. Thanks again for listening. Like Lauren just said, please like, subscribe, and share, and do all the things that you think you should be doing to help me and Lauren become podcast stars. Just kidding. We appreciate you for showing up. That's really all
Not
we
kidding.
need.
Not kidding at all. Do all of those things.
I'm gonna let
Thank
end.
you. Bye, guys.
No,
What?
do the thing. This is
What?
This has been the Oakview Podcast.
okay. Cal.
The,
You
want to do it? You should do it.
Do you want me to?
Take us out,
What
Cal.
else do we say?
Yeah.
I just
Okay, this has been the Oakview Podcast. Thank you so much for listening, and we hope to see you back next week.
all right. Bye, guys.
Bye. Thanks again for listening to The Oakview. You can follow Lauren and Emma on Instagram at The Oakview Podcast, OAKVIEW, or email us at theoakviewpodcast@gmail.com.